Okay, to be cognizant of everyone's time, let's go ahead and start moving forward. Welcome everyone to the University of North Texas Health Science Center, at least virtually. Here today, my name is David Mansdorfer. I am Special Assistant to the President here at the University of North Texas Health Science Center. I am in a past life also the Deputy Assistant Secretary for Health, and had the opportunity to work with our guest speaker today, Dr. Dorothy Fink, who is the Deputy Assistant Secretary for Health for Women's Health and Director of the Office of Women's Health that resides in what we called OASH, or the Office of the Assistant Secretary for Health. Dr. Dorothy Fink has just a wonderful background. It was wonderful working with her. She is board certified in endocrinology, internal medicine, and pediatrics. And she is a physician leader on topics such as diabetes, nutrition, and bone health. Previously, her clinical practice focused on women from adolescent through menopause and beyond, and she is a nationally certified menopause practitioner and an expert on estrogen. Dr. Fink went to Georgetown University undergraduate, focused on health studies. She also developed a passion for public health there as well too, and she received her medical degree from Georgetown University School of Medicine. She completed her combined internal medicine and pediatrics residency at the University of Pittsburgh Medical Center. She then completed a National Institute of Health postdoc fellowship in endocrinology and metabolism at the Columbia University College of Physicians and Surgeons in New York. So with that, again, it's a pleasure to have you here, Dr. Fink, and I will turn it over to you for your presentation on women's health.
Great, thank you so much. Thank you for having us join you today. We're thrilled to be able to share some of the exciting work that we are leading right now in the Office on Women's Health. During today's discussion, I will share a little bit more about OASH, the Office of the Assistant Secretary for Health, and our Office on Women's Health. We'll go into some of our office priorities, our campaigns, resources, and I look forward to also entertaining and discussing some questions with you all. Within the Office of the Assistant Secretary for Health, we lead many different initiatives, and you can see some of those photos on the right-hand side of the slide bring to life the incredible work that we do, from providing trusted data and information to convening partners, to developing novel initiatives, and to organizing and leading national initiatives. And I'll just point out, these were many of them pre-COVID, as you can imagine, but we really do a lot during Women's Heart Month. With this, you can see the Red Dress Fashion Show there at HHS, and Admiral Gerwa, who's the Assistant Secretary for Health, and Admiral Adams, who is the Surgeon General, and all of the incredible Commission Corps officers whom we work with, which I know you're all lucky enough to get to know the wonderful Admiral Trent Adams, who's in this photo with the ASH and the Surgeon General. But we really have an incredible group of people, and I look forward to sharing more about our Office on Women's Health in the upcoming slides. First, though, I do want to talk a little bit about our office when we think about HHS, whom we're under. And what's neat about HHS is, in 2017, when the president issued an executive order to really look at thinking about reorganizing some of the different executive branches, HHS really launched an incredible reimagine process to evaluate how our agency can best perform our mission. And I'll just highlight a few things here in terms of our strategic shifts, but really looking at leveraging the power of data. And we'll talk a little bit more about that when we think about our maternal health work, which we'll get to in some upcoming slides. But really thinking about how we can work towards knowing what's going on the front lines of health and of public health, and to really be thinking, how can we in turn manage our work and use our budgets most effectively, knowing that we are working with taxpayer-funded dollars that we ultimately want to get back to the people and have the biggest impact. And so I look forward to sharing with you in terms of how we have responded to this in the Office on Women's Health. Our Office on Women's Health, as we stated, is located in the Office of the Assistant Secretary for Health. We are responsible for coordinating and ensuring collaboration among the many federal agencies involved in women's health activities. We really ensure collaborative federal activities are carried out in an efficient, consistent, and timely manner. We also develop and implement strategies for achieving the highest possible level of health for all women, as well as identifying and bridging gaps in federal strategic planning of women's health activities. Here you can see our vision, our mission, and our goals. And our vision really is that all women and girls achieve the best possible health. And in the title of our office, it says women, of course, but we really truly are committed to women and girls across the lifespan. And you will see that come to life in the upcoming slides, where you see our programs that really do look at women and girls across the lifespan. You'll also see our goals listed there in terms of our impact on policy, education, and really thinking about innovative ways to approach aspects of women's health that really haven't been addressed before. On this slide, you'll see our coordinating committee on women's health with OWH in the center. And, it's an incredible role we have where we sit, in that we really do coordinate across all of the different agencies, across the HHS and beyond. Currently, we're working with the Office of Violence Against Women at the Department of Justice. And there's just so many offices across the federal government that impact women's health. And there are incredible roles for us to really work across the board with all of them. We also work across the U.S. With all of the regions. And so there are 10 regions where we have women's health analysts that really work towards getting information from stakeholders and bringing that back to us, such that we can have the most comprehensive approach, taking into account what's happening in specific states. In terms of our priorities, what is listed here is by no means an exhaustive list, but we do want to share some of them with you and include some of the ones that we'll include in our discussion today. And as you can see here, we respond in real time to anything and everything public health related. And so COVID-19 is very near and dear to us right now, as is breastfeeding, and really disparities underlies all of the work that we do across all of these topics, but we like to include that as a separate one too, to ensure that it's clear what our work includes, as well as HIV, hypertension, immunizations, maternal health, opioid use, physical fitness and health across the lifespan, as well as preventing violence against women. In terms of my office and our COVID-19 response, we have, a really incredible collaborating role across the federal government, and we coordinate within HHS as well as with external stakeholders. We work with the Office of Minority Health and really think about the racial, ethnic, and geographic disparities among women. As we are leading a lot of work in maternal health as well, and we'll share some of those announcements with you that we've put out recently over the course of this presentation. We think about that in the context of COVID as well. And then additionally, when it comes to thinking about the vaccine and thinking about safety testing in women. In terms of information that you can access via our womenshealth.gov website, we share in as close to real time as possible all of the different press releases coming out of HHS when it comes to testing and vaccines and Operation Warp Speed. So please check that out. We include places for community-based testing and links to the CDC. And we're always looking to share as much information as we can with everyone who's connected to our website and social media channels to really help with the coordination of this information across the federal government. Next, I'm going to get into some of our grants and cooperative agreements. And so this first one is the Prevention of Opioid Misuse in Women, our OWH Prevention Awards, which are community-level interventions for prevention, screening, and response to opioid misuse and overdose. And so you can see a little bit more information about this here. Our goals are really to address primary and secondary prevention of prescription and non-prescription opioid misuse in women across the lifespan, as well as identify potential gaps in the ability to reach the communities of women in need. The next grant/cooperative agreement that I'll share with you today is our Preventing HIV Infection in Women through Expanded Intimate Partner Violence Prevention, Screening, and Response Services. And in this cooperative agreement, we really look to support victims and survivors to lessen harm after experiencing IPV, including activities that aim to prevent HIV transmission, increasing HIV screening, and improving accesses to services for individuals with newly acquired HIV infection, as well as promoting social norms that protect against IPV. And another one is our Youth Engagement and Sports Grants, where we collaborate with the Office of Minority Health and the President's Council on Physical Fitness to really look at improving physical activity and nutrition via increased sports participation, physical activity and nutrition programs, really focusing on grantees that include racial ethnic minorities, as well as socioeconomically disadvantaged youth. It's been really incredible to see how even during COVID, these grantees have really worked to find unique ways to engage with youth around physical activity. So this is another example of, really thinking about how we work across the lifespan with women and girls, and are really trying to think of many ways of prevention across the lifespan. Next, I'm going to transition into our hypertension work. And so on this slide, you'll see preeclampsia and women's health throughout the lifespan. And what I really think is important, and it's not just preeclampsia, it's I think of all the women I've cared for in my life with diabetes and pregnancy, and many conditions that occur in pregnancy but don't just disappear after delivery. And that includes both preeclampsia, diabetes, and many other things that we can, if we think about them and address them during pregnancy, and then continue to think about them after delivery, we can have long-term impacts on both women's and their infants' long-term health. And that is what we are doing with some of our projects. This slide goes into a little bit more of the details about blood pressure that impacts women during pregnancy. And in the US, high blood pressure occurs in about 1 in every 12 to 17 pregnancies among women ages 20 to 44. And then we also think about that in the greater context of maternal mortality itself, where pregnancy-related maternal mortality for Black women and American Indian and Alaska Native women are 2 to 3 times higher than for white, Hispanic, and Asian Pacific Islander women. And so we're always trying to think about, okay, well, what are the upstream impacts? How can we think about hypertension control as a way that we can work to reduce maternal mortality rates? And in this slide, you'll see a challenge that you can find on challenge.gov, which is a focus on identifying innovative programs that are caring for women with hypertension who are pregnant and or postpartum. We're really focusing on racial ethnic disparities as well as urban-rural disparities. And our goal is to demonstrate sustainability and the ability to replicate and or expand a program that provides effective monitoring and follow-up of hypertension for women who are pregnant or postpartum. And we're really excited for this challenge. It's an over $3 million challenge where, so many times when people think of hypertension, it's later decades of life. And, while preeclampsia is by no means a new condition, it has existed for many, it always existed. Women can develop hypertension during pregnancy and have severe complications. There is no doubt that hypertension rates among women who are pregnant have gone up significantly in past decades. And I always challenge us to think about, how is it that our grandmas and our moms were giving birth in times where women did not have the same rates of hypertension. And so it's not that it was, a century ago that this happened. It's within our lifetimes when hypertension was not as common in women of reproductive age. So we're really looking to bring the focus to hypertension during pregnancy and postpartum. And through this challenge, there's the monetary award for the challenge, which is great to award these programs that have made a difference for women. But we're also excited about just getting that network together and getting people thinking about this topic that is not always the focus when we discuss hypertension in general across the lifespan. Additionally, you'll see some of our other programs in OWH related to maternal health, including our Move Your Way Maternal Health campaign, where we're partnering with the Office of Disease Prevention and Health Promotion, who lead the physical activity guidelines. And we said, Move Your Way is so important even during pregnancy and postpartum. I know even from caring for women with diabetes and pregnancy, the impact of just walking after eating on blood sugar levels was a very incredible impact that required, not always a ton of medicine, but just physical activity. So we're excited to be working with our colleagues on this campaign and building out Move Your Way to include pregnant women, as well as this campaign, our It's Only Natural campaign, which is focused on improving breastfeeding rates among African American women. And I'll tell you a little bit more about our breastfeeding work in upcoming slides too. But just thinking about my recent words with you with hypertension, we just had this National Women's Blood Pressure Awareness Week that we led. And one of the most popular messages was how we connected breastfeeding to lower rates of hypertension. And I think I share that with you as something that, our office is always looking to, of course, share the messages that are the messages we always say about hypertension, right? But what are those messages that don't always get said? And a lot of times we focus so much on the impact of breastfeeding on the baby that we don't make those messages clear about how breastfeeding can impact a mom's long-term health. So more to come on the upcoming slides for that, but we're really looking to focus on breastfeeding disparities as well. And then here you can see this campaign is really focused on postpartum depression, and we're looking to lower the barriers women face in talking to their healthcare provider about symptoms. Okay, so I mentioned a little bit more about breastfeeding on that last slide, but we're, as part of what I'll get to in this next section, is really thinking about the racial and ethnic disparities that exist among women initiating and continuing breastfeeding. We had a Surgeon General's call to action back in 2011 come out that really was a call to action for breastfeeding, and we're looking forward to updating that in the upcoming year or so too. But just so you know, that is out there. And in terms of these disparities, we're really looking to address the racial ethnic disparities that you can see here. It's also really interesting looking at the disparities among infants that are eligible and receiving WIC, as well as the disparities among ages. But we're thinking about all of these as we are implementing our OWH breastfeeding challenge. So this is another challenge that you can find on challenge.gov, the link to it. And that was just recently launched, just like our hypertension challenge. And as I go through these, please remember to go on that website and check them out. We'd love to have as many people, submit their programs, and we have the these challenges were just announced at the end of September, and the registration and the first phase submissions are due on November 16th. So these are hot off the press initiatives that we're looking to really improve women's health, and we encourage you all to check those out. For the breastfeeding challenge, we're really looking to identify effective pre-existing programs that increase breastfeeding initiation and continuation rates and decrease disparities among breastfeeding mothers in the U.S. Our goal is to demonstrate sustainability and the ability to replicate and or expand a program that has proven outcomes to improve breastfeeding rates and reduce disparities. And we're really looking from whether it's education, instruction, or support for women in the U.S. We're looking to hear from everyone. So if you or you know anyone who would be interested in any of these, please be sure to share this information with them. Again, the deadline for those submissions is November 16th. In the next slides, I'm going to move into immunizations. Admiral Jawad, the Assistant Secretary for Health, has really been an incredible inspiration and lead when it comes to vaccinations. And one area that we're really focused on is improving HPV vaccine uptake. And we're really looking to think about how we can have an integrated delivery networks and health systems enhancement to improve HPV vaccination series completion to 80% in the next 5 years. From our office, and this is going to be hot off the press in the next upcoming week, so we encourage you to check this out because this campaign, the HPV Vax Now, is one of the states is focused actually in Texas. So we'll look forward to hearing from you all and hearing your feedback on this. But this campaign is really focused on the long-term goal of increasing HPV vaccination rates among young adults ages 18 to 26 in Mississippi, South Carolina, and Texas, where there are significant disparities in the vaccination rates. There will be more to come. We'll be focused both on the healthcare providers as well as the young adults. So please look out. We're hoping to make this announcement in the upcoming weeks, and we'll be excited to share all of the toolkits and information with all of you as well as we look to get this information out to as many people as possible. This slide, continues to describe some of our vaccine work. And, as you can imagine, vaccines are at the forefront of our minds now when it comes to COVID. I share this with all of you too, because a lot of this information here even thinks about our pre-COVID lives, thinking about childhood vaccination rates in the U.S. And last year when Admiral Jawad and the Surgeon General wrote the op-ed about really focusing about the truth about vaccines. And so, we're looking to really be thinking about vaccinations now as well from the COVID perspective, not just all of the excitement about the super incredible work of Operation Warp Speed to be working on a vaccine for COVID, but to also be thinking, how much we appreciate the impact of COVID on vaccinations, whether that's childhood immunizations or any immunization, you name it, across the lifespan. And we work very closely with the Office of Infectious Disease and HIV/AIDS policy to really focus on getting those messages out about the safety in getting vaccines now and how through many of the different policies that have been impacted, even in times of COVID, where many people with children can now receive vaccines at the local pharmacies, and just thinking about more ways we now have access. Another program that we're working on within our office is enhancing immunization culture during obstetric and gynecological care. And, we really appreciate that a lot of times vaccine decisions are made even before a baby is born, and ensuring that a mom is empowered to have as much information as possible about vaccination rates early on, and to focus on immunization culture, both in OBGYN practices and in family practices involving prenatal health care. We're really excited to be focusing on those areas and really thinking about areas across the U.S. where they have the highest non-medical exemption rates, and how we can get into those communities and work with them to find ways to increase these rates. Here's a little bit more information from the vaccine perspective. So this is the vaccine office, the Office of Infectious Disease and HIV/AIDS Policy. You can see, the flu that Admiral Jawad and the Surgeon General have been highlighting, and just things to share with others that we have coming out of OASH too. On vaccines.gov, there's the vaccine finder, and there's just so many ways to get evidence-based information out there about vaccines. And we are all for, working within our office when it comes to women and girls health, but also supporting the larger messages of OASH and the vaccine office through the Office of Infectious Disease and HIV/AIDS Policy to get those messages to the people. In the next part of the talk, I'm going to move into some of our observances that we hold every year. So here you can see our National Women and Girls HIV/AIDS Awareness Day, which we hold every year on March 10th, where we bring together local, state, federal, and national organizations to shed light on the impact of HIV and AIDS on U.S. girls and women. This year, in 2020, marked our 15th observance, and we really, this year, focused on teaming up with, again, the Office of Infectious Disease and HIV/AIDS Policy, because they are the home of the HIV epidemic, and really look to get that information around EHE out to women and girls, and share information such that it has never been done before, with our offices teaming up together to really have focused, directed information to women and girls. So we're really excited for that, and we'll have our 16th observance coming up this March, so be sure to look out for that. Here you can also see Dr. Beckham and I wrote a blog about the HIV Prevention Starts With Me, and thinking about the EHE and the impact on women and girls. You can find a lot of this on both hiv.gov and as well as on womenshealth.gov. Our next observance is National Women's Health Week, and this is another observance that we have every year. It's always in May, beginning on Mother's Day, where we really focus on many different aspects of health. This year, as you can imagine, we had a special focus on COVID, which we have continued, and we really look to share as much information as we can during that week and month to encourage women to focus on different aspects of their health. This year, we actually added a new observance that I referred to earlier in the talk. That was earlier this month in October, and we really have, as I mentioned, been focusing on hypertension across the lifespan, but we definitely have had that unique focus on women during the years of 18 to 44, where we appreciate that so much messaging is focused on decades later, when we do that, so many times women in these other decades think, oh, well, my risk of heart disease isn't there. That's something my grandma will have, or my mom. But we're really focusing on messaging around blood pressure during these critical years, where we know the impact of high blood pressure on pregnancy, and in terms of the long-term impact on both the mom and the baby. So this is our first inaugural year of this observance, and we look forward to continuing to develop this. We announced our hypertension challenge during that week, and I'll also share the Surgeon General earlier this month put out a call to action on hypertension. So we've really had a lot of pretty amazing focus areas on hypertension this month that will continue even beyond this month because of the impact we're looking to have. Okay, so in this last part of the talk, I'm just going to talk a little bit more about our websites and some of our social media channels for you all to be aware of. So here you can see on the left-hand side, we have our womenshealth.gov, which is a wonderful website that includes all sorts of topics. I share this with you here, the postpartum depression summary for anyone who comes to our website. What's really nice, and you can just see the beginning part of it here, and you can see more on the website, but it's in a really nice question and answer form where you can click on the plus sign and have more information come down. But what we like about our approach is that in the question and answer format, it also can help people who come to the website think about questions that they can talk to their healthcare provider about their specific condition. So it's a really great resource for women across the lifespan. And we also have our girlshealth.gov that has a lot of great information for girls. Here you can see a Best Bones Forever campaign from prior years. As David had mentioned, I do have a special passion for metabolic bone health, and I just put this plug in for this program, and that, you know, we're really always thinking not just at the time period where we think people get fractures, which is, my grandma got a hip fracture in her 90s, but we appreciate that bone health really begins in the teenage years into the 20s and early 30s. And peak bone mass is such an important topic that is not something that's common to talk about. And so our office for many years has always been thinking, how do we think as far upstream as possible, and not just during the time of an acute event when someone needs surgery, like a hip fracture, but rather how can we work years in advance to truly have an impact. On our website, there's some really neat links for healthy living by age. And you can see across many different decades where women can go to get specific information about things to be looking for at appointments and asking for different health screenings. So that's pretty cool in terms of really being able to focus on every different decade of life. And here you can see some other ways to connect with us. You can see our Facebook, Twitter, YouTube, and Pinterest. We're also looking to develop our Instagram footprint, so that will be coming soon too. So lots of excitement on all of these fronts. And in conclusion here, I just want to say, and even during today's presentation, I couldn't touch on every single incredible program that we're leading, but we are really thinking across the lifespan, and we have some incredible work on neonatal abstinence syndrome and that extends all the way, across life to thinking about another challenge that we worked on with ACL earlier this summer, focusing on social isolation and loneliness. And while that challenge, compared to the ones I discussed earlier with you all, they're active, that challenge just awarded its phase 1 winners, but that was a partnership between ACL, which is the Administration for Community Living, and OASH with our office, where we were really looking to identify innovative ways to help people with social isolation and loneliness during times of COVID. And so check that out too. You can find that on the ACL. It's called the Mental Health Challenge. But as I stated, we're committed to women and girls across the lifespan and are always looking to really find ways to ensure that we are impacting women and girls at all of those important life points. So that concludes my presentation for today. I am happy to take any questions and look forward to talking with all of you.
Great. Well, one, I'll go a little inside baseball here and just say how impressed I am from Dr. Fink. You took over in 2018, correct?
Yeah, I think it was December of 2018. I'm almost at 2 years.
Yeah. So, to give a little bit of the backstory, Dr. Fink took over an office that, there was lots of great program, but the strategy was a little bit missing, and the outcomes based approach was a little bit missing. So it's amazing to see how far you've taken that office from what I always used to say back at HHS was being able to tell us how we spent our money to being able to show us what we're getting from our money. So one, it's impressive to see how far it's come even within 2 years. But second to that, and I know we've talked a little bit about this, there are alumni and students on this phone call too. I know you're currently recruiting for several positions over in OWH. So you want to tell us a little bit about some of the positions you're recruiting for and or how to do that?
Absolutely. So in our office, we were really thrilled to be building it out, and really, as you mentioned too, that focus on outcomes and evaluation. And to me, when I think about the millions of patients that I've cared for over my life, and I think about how do we connect our work in public health from the Humphrey Building in Washington, D.C. to all the real people. And when I say the real people, I mean, our patients, all the communities, and the frontline workers. That term, the frontline, has come up so much in COVID, but that to me is something that has been near and dear to me from my whole life, actually, because sometimes I think, how can we get messages to not just be coming from those of us who are not directly in patient care, but how can we really make sure that we're engaging to make sure that we are connected with what's actually happening in real life when providers are giving care with EHR and running around, so as to support them and not add another regulation. But in terms of, what we are looking to do with our specific hiring right now, and we have some positions that there are a few that are in process, and I'm happy to share more as they come to be. But we're really looking to develop our office, in that we have some public health analysts at a number of different grade levels, including at like the GS9 level. So for anyone who is a recent graduate, or shortly after that time period, to really help build out our office and really think about how we can bring outcomes to the people. And those challenges that I mentioned are one example of that, in such that we're really looking to put our funding where we give the funds as much as possible directly back to the people who are doing the work with the women and girls in our communities. So public health analyst, that's one of the main positions that we're looking at right now. In terms of, public health analysts can range from many different topic areas. We even have public health analysts who have focuses on, for example, on communications and all sorts of things. And that we, one of the most important aspects of what we do is also getting the information out to people. And while we have very successful communication lines from our social media and websites, we know that there are many women that don't know our office exists. And so we're always looking to say, how can we really get ourselves out there and get to the areas where we haven't had a presence yet. And would love to share any usajobs.gov announcements as they come up, as we're building out our team And we're always looking for people who are excited to get in there and get good work done on behalf of the women and girls of our nation.
Absolutely. So I'll turn to actually a couple medical questions that came in that kind of respond to your background in bone health. But one of the questions that came in was, should a college girl take things like Caltrate for bone health? If so, how many? And does your response differ if the girl has had knee surgeries?
You know, it's a great question, and it's one of my favorite topics, actually. I find that, you know, it's so interesting when you think about, you know, vitamin D has been a lot in the news, even now with COVID, in terms of the inverse relationship between low vitamin D levels and higher positivity rates of COVID, being positive for COVID. Of course, these are not randomized controlled trials, so, you know, they're associations, but they are important things to be thinking about, both calcium and vitamin D. And so, you know, my biggest message for any vitamin has always been, get as much as possible through food. And there's so much, you know, information online about this, and it can get confusing, but really, calcium through food is what's most bioavailable. And so finding calcium sources through food is what I recommend for anyone across the whole lifespan. In terms of the specifics of that, some people will say, well, can I get it? What about, is it dairy versus non-dairy sources? And, you know, I can't get into every article on that now, but I definitely am pro natural sources as much as possible. So when it comes to yogurt, milk, kefir, which is it's fermented milk essentially that has tons of bacteria in it. And there are neat studies looking at bacteria and how that can help bone health too, meaning your gut bacteria, that is. So the bottom line is, I'm all for natural sources of calcium, and you can find some pretty neat articles, nutrition articles on kefir and bone health too. But there are guidelines in terms of how much calcium to take at different stages of life. And so I would refer to the Institute of Medicine has the different RDAs in terms of how many milligrams in a given time period. But if at all possible, getting calcium through food is 100% the way to go. That's the way I do it myself. I do appreciate that there are cases where people cannot do that and pills are the alternative, but keep in mind that, you know, it's much harder for your body to balance pills in terms of the regulation of it. And when you take a 600 milligram tablet of calcium, it's a huge load all at once in your body, and you end up peeing a lot of it out. So when you do, you know, calcium, we often do in the bone world, you know, 24-hour urine calcium checks on people. And that's annoying because, you know, they're sent home with a jug to collect their urine for 24 hours. But it is fascinating. You can tell if someone is overdosing on calcium pills because their urine will often have high levels of calcium in it. And that can lead to kidney stones and all sorts of things. So the bottom line is calcium is very important for your bones. And I'm not saying not to take it by supplement, but I would definitely read about ways to get as much as possible through food, because it's definitely possible. And this question ties into vitamin D, which I brought up. The caveat to vitamin D compared to calcium is that it's really hard to get vitamin D through food. With a caveat, I will say that I had one patient who decided that she was going to eat sardines, a can every day with the bones in them. And she ate so many sardines that her vitamin D level actually went too high. But that was one case. So I do share that with you, that the caveat that it is possible to eat too many sardines and get a normal vitamin D level. But most people don't choose to do that. So I share that with you, in that vitamin D is really hard to get exclusively through food compared to calcium. And when I have patients who I've cared for with bone conditions at any stage of life, because as I mentioned in this talk, fractures can happen even in teenagers when they're developing their peak bone mass. I do recommend vitamin D. And then I would also say, check out the vitamin D and COVID relationship. Again, still being researched, but it's an association that going into these winter months, albeit you all in Texas have more sunshine than we do right now, but I would definitely recommend you reading more about vitamin D and talking to your healthcare provider about how to supplement that. But yes, and I'm happy to follow up if you have a more specific question about calcium, but I'll stop now. I could talk about it for the rest of this time, but I will hand it back to you, David, for more questions.
Well, I mean, I've had several of these conversations with you on, everything that you were trying to instill at HHS when I was there. But one of the interesting reports, and you touched on it a little bit, was that during COVID, there's been a significant decrease in youth sports activity. And you couple that with an already significant disparity in how girls continue on in sports from the early ages, even up to college. So you want to talk a little bit more, because I know it's something we both worked on when we were there, about how you're working with the President's Council on Sports, the Office of Disease Prevention, Health Promotion, on making sure that that kids and girls particularly have access to the benefits of youth sports.
Absolutely. And it's a huge challenge right now with COVID in terms of, team sports, et cetera. And that's something that has come up with our youth engagement and sports grants. And, it has been incredible to see the grantees and what they have done in terms of virtual interactions. But we all appreciate that there's nothing replaces running around on a field with your team or doing whatever activity in a group of people in person. So we are really looking to do as much as we can, though, from that virtual standpoint. I can share, and I think this was just put up on YouTube. Christina Harder, who leads the President's Council, they just did a neat interview with 2 astronauts about physical activity that you all should check out. It's pretty amazing. But we're really looking to work within the confines of the guidelines now for physical activity and encouraging, thinking about ways to get families to be active in ways that they haven't been in the past. And then if children are, depending on the situation in a given state, if they are, in settings that they're still able to be active, but then also, looking to share ways about being active from virtual settings. But then, we appreciate that there will be, we look forward to the time when we can all get back together for sports. And we are keeping our fingers crossed that with the vaccine timeline and things, and hopefully, good things to come on that front, that there will be a time where we all get back together. And I can share that, we're really excited to be working with ODPHP, the Office of Disease Prevention and Health Promotion, and the President's Council to really bring back the President's Youth Fitness Awards. And I'm sure a lot of you remember that growing up. I definitely remember how much fun it was to get that certificate and think like, oh my gosh, the President signed my physical fitness certificate. And that whole process has been, it's from what I remember, at least in the 90s, it is not as robust in the past 10 years, say, as it had been in years in the past. And so we're super excited that we're going to be bringing that back, hopefully by next fall. But again, it's in process. But we're really looking toward even, excited for life post-COVID too, to bring back programs that have been successful. I think, I forget, it was a president many, many decades ago that instituted the President's Fitness Awards, but we're really excited to be thinking about how to bring that back after it being on a little bit of a hiatus for a number of years, at least 10 at this point, where we want to bring it back and really think about ways to engage with schools in unique ways, and depending on the COVID situation, work within that, but really think about how we can best get those programs back into schools and not lose that aspect. Because like you said, it's hard enough with girls in sports, even at baseline pre-COVID levels. But I do think that when we look at those rates, there's a lot of low-hanging fruit and programs from decades past that have been successful, and we're excited to be bringing them back in new ways.
Great. With that, we'll make sure that we end on time. I just want to say thank you, Dr. Fink. It's been very informative. I see also a fellow colleague of ours just pop up, Dr. Trent Adams, as well too. Dr. Trent Adams, for everyone's knowledge, she recently joined us here at the Health Science Center. She was former Principal Deputy Assistant Secretary for Health, as well as Acting Surgeon General and Deputy Surgeon General. So you're starting to get a little bit of a HHS crew here at HSC. Yeah. But, Dr. Fink, again, I'll reiterate, it's amazing how far you've come and how far you've taken that office in 2 years. Very impressive. And two, just thank you for taking some time to talk to us today about the number of wonderful initiatives that you've given.
Oh, absolutely. Anytime. And if you all have follow-up questions, feel free to, get them to me in any way, and we're happy to follow up. And then please do check out challenge.gov for that, both the breastfeeding and hypertension challenges. Again, those submissions are due November 16th. And please share them widely. We're really looking to get as many submissions as possible and really connect with programs that may have 100 or so people in them in one area, but could be replicated and built in other areas because they've shown success and have shown to really reduce those disparities that we're looking to address. So check those out, and then let us know. We're always looking for new people to add to our office, and so look out on USA Jobs, and we're always looking too for interns and fellows. So check us out on our website for that too.
Sounds great. Well, thank you everyone for joining us here at this virtual HSC forum, and have a great rest of your day.
Okay, thanks everyone.
Thanks.